Welcome. Thank you all for being here. So this session will explore what it really means to invest in healthy populations. We'll ask how can governments, the private sector, and philanthropy align efforts to build sustainable health systems? And what are the practical steps that we can take today to ensure tomorrow's societies are healthier, more equitable, and better prepared for future challenges? So, Ruggero, I'd like to start with you.
Thank you.
What are some of the practical policy levers at the EU level through programs like EU for Health or Horizon Europe that could help member states make the shift toward prevention and avoid the trap of short-term cost cutting?
Thank you, Amanda, and thank you for invitation and for this opportunity to exchange ideas. I wrote some notes for two reasons. First of all, to respect the time, and second, to help my English. I don't know if probably the second is the first and the first is the second, but I would like to express my thanks for this invitation. In recent years, we have learned that health is not a cost, but a strategic investment in economic resiliency, in social cohesion, and most important, in citizen trust in institutions. That's why if we truly want to invest in the future of health, we must make some clear choice. And I will try my idea with some simple proposal. First, and that's for state members of the European Union and for our budget. Today, prevention, it means screening, vaccination programs, the promotion of healthy lifestyle, is recorded for our budget as current expenditure. This is not a good idea because prevention is not a current expenditure, but is an investment, an high-level investment. And for our Stability and Growth Pact, if we retain that prevention is a current expenditure, we can't invest, so we can't do the correct level of programmation on these subjects. The second, for me, most important point is how Europe invests in the health sector. We have one important program, EU for Health, with more than 5 billion euros of investments until 2027. It represents the largest commitment ever made by the European Union, and it was announced after the pandemic crisis some years ago. We have another opportunity, the Recovery and Resilience Facility, and there are a lot of member states who invest really a lot of money in this sector. But we have to look frankly the reality. Because we have a lot of money who are programmed, but we don't deliver it the expanding attention. And now we have another very big problem on EU for Health, because in the European Commission proposal of the new MMF, we don't have EU for Health. Because we have only one fund for competitiveness, and inside we have EU for Health. We don't agree on this decision, and in the next year we have to work to maintain EU for Health as program inside our budget. Another important proposal regards the public and private partnership. Biomedical research, pharmaceutical production, technological innovation require a genuine alliance between institutions, universities, and enterprises. We need transparent rules, and we need to protect the intellectual property. But we have a big absentee in this debate, geopolitical. Because that's my idea, securing raw materials and producing active ingredients for the pharmaceutical industries requires investment and rules that allow this industry and applied research to remain in our country. This is a strategic point in Mario Draghi's plan for Europe, and I believe that is a good point we have to maintain. Finally, research and planning. The new MFF of our budget have a good opportunity for research because Europe decided to invest 20 billion euros to increase this opportunity. Maybe we need that university, states member and enterprising must communicate more and plan together. The same goes for programming, which means innovating consciously, and we have a positive experience of some program. European Cancer Plan is a good planning during a lot of years. Now in Parliament we are working on a cardiovascular plan, on pharma legislation, on the Critical Medicine Act, and we are introducing a new and more correct rules on medical devices. So we have a lot of work in front of us. In conclusion, my idea is that when it comes to health, we should not be afraid to talk about investments. A good system guarantees citizen health, makes target investments, and drive economic growth. If these three things do not happen together, it means that the decision maker probably is in the hands of someone is something to lead. Thank you.
Thank you very much. A lot of important points there. And I like what you said about, it's about making choices. I'm
sorry for my English.
Oh, there's no apologies. It was wonderful. Thank you. I also think your point about public-private partnerships is really important. And I wondered, Christina, if you could pick up on this a little bit. You often sit in a really unique place at the intersection of research, healthcare delivery, and policy. And I'm curious what role you see for the private sector in making health systems more sustainable, whether that's through new payment models, partnerships, or innovations that improve outcomes and reduce efficiencies.
Thank you. I think, first of all, it's very refreshing to hear this whole debate that suddenly everyone is accepting that health is an investment that yields returns. And it's one of the days where I feel really satisfied from the morning. This is all I'm hearing, right? And it's a strong case from prevention to early interception to screening to treatment to cure. That all there's a place for everything, and they all have a big, strong economic return. I think that's really important. And I'm really pleased to hear about your thoughts about the budget, because I think one of the big challenges, be it from a private perspective or public, is right now there's a big fragmentation of the system, right? So someone's paying today, someone else is going to benefit tomorrow. There's short electoral cycles. There's fragmentation of budgets. People are trying to meet the budget, but who's looking at the outcomes 10 years down the road? So I think it's really important to address, and great to see EU for Health, of course, and but share the concerns about what's going to happen going forward. So I think there's a role for everyone to play. I think one big issue right now is the efficiency of the system. It was mentioned earlier, the big significant waste we're seeing, like the OECD's flagged probably a fifth of resources are wasted. So what are we doing collectively to make sure that, because everyone says, budgets are limited, and I know we are living in a time where, there are more demands. We do have an aging population. We do have more chronic disease, but sort of accepting that, we should actually embrace that and say, we need to address that. It's not budgets are flat, but of course, stakeholders have big concerns with geopolitical tensions, economic tensions. They have to sort of fit their budget somehow, but actually there's a lot of efficiencies to be made within the system. There was a study, I think, from OECD saying transformational policies would actually, rather than this cost-cutting exercises we're seeing, would actually bring a huge return, probably 1.2% of GDP compared to all the other approaches. And that's just reducing half of waste. So I think this is the big challenge, to actually have a system that looks long-term and that actually looks at reducing or eliminating these problematic inefficiencies within the system, which is obviously the most difficult thing to do, right? Cost cutting is a very quick and easy exercise. Now, what can we do as partners? And I think it requires all stakeholders to work together. We are seeing increase in public-private partnerships. We can leverage, the role of data, right? And we can do that. We've engaged many times in, developing a federated data network, right? So that we get this data. We did it, for example, in multiple myeloma, so that we actually have the information needed to actually have this real-world evidence sort of guiding us. So we have more value-based approaches to what we do. as a corporation, we're engaged in probably 180 public-private partnerships, innovative health initiatives, sharing information and making sure that we're all engaging with the right stakeholders to advance this discussion. But obviously, it's not something we can do alone. But there's a very powerful role, I think, if we put value-based healthcare at the core of everything we do. Then I think if we can all come together around that and say, what part each player in the system can do to bring that. Be it. We've done a partnership recently with a University of Helsinki hospital, right? So working with partners there to actually find the optimal care pathways for patients in depression, for example, to make sure that the outcomes are maximized. So I think when we work together, we can actually really make sure that the system is more efficient. And of course, to speak more positively, because there's a bit of doom and gloom, right? The next generations are not going to live as long as we were. And it's true. I mean, the data says that if we actually stay at the same percentage of spending, life expectancy will go down by 4 years by 2050. So that is something that the research is showing, but also recognizing the incredible progress that has happened. And we don't want to lose these great strides that have been made by suddenly just restricting us in this kind of budget mentality where we're all pre-accepting that nothing could be done because we're in a tough situation. So it's a huge investment to be made in health that will deliver. So.
Great. Thank you. And I like what you were saying about waste, because there was a point earlier about it doesn't just stop there at reducing waste and saving money, but that allows for further investment and creating more headroom to adopt these new sort of effective things that are coming down the pipeline. So yeah, thank you. Charmaine, I'd like to come to you next. We've been, kind of at the systems level, thinking big picture. But I'd love to zoom in a little, because the British Heart Foundation invests in both research and advocacy, from funding cutting-edge gene therapies to shaping tobacco legislation. Can you give us a sense of sort of, in your view, what combination of research breakthroughs and public policy measures have had the greatest impact in tackling cardiovascular disease? And what lessons can we apply to other major health challenges?
Cool, Amanda, that's a tough exam question for this afternoon.
Sorry.
That's okay. Do you know the short answer is I think it takes all investment at all levels. For over 64 years, the British Heart Foundation has been a leading independent global investor in cardiovascular research, everything from basic biology to supporting clinical trials. Long term, we invest in research to drive breakthroughs. Medium term, we try and affect policy to change the system and practices for patients. And short term, we're there for millions and millions of people every month who come to us. None of that, to echo what others have said, has been done in isolation. We work with partners across sectors to make sure that we're delivering the very best progress for patients. I think probably one of my reflections, so you asked what the things that make the biggest difference. It's hard to pick because we're proud to have been part of science that has done things like help develop statins that are now taken by, millions and millions of people every day, to actually changing legislation here in the UK around tobacco availability, particularly for kids, and much more besides. I think probably one of my reflections on listening to the conference and the sessions today is implementation is absolutely vital. It's very, if I take CVD for a moment, it's very clear we've got a big crisis. We've got 1 in 3 people dying globally for cardiovascular disease. Some of the trends that we're worried about are getting worse all the time, and we're seeing generational shifts and upticks of things we wish we were getting better, helping threaten to reverse that progress. And one of the things for me is just thinking about what we can do about it. So we do have a big problem. The good news is we know what we need to do to make that better. But the art of that is in the implementation, which is why we're looking to the cardiovascular plan in Europe and also the 10-year health plan here in the UK. The former, we hope, is out by December and are inputting into, and the latter we're contributing to. And so for me, the development of those plans that involves a cross-sectoral approach and having a really clear vision for what we're trying to do for patients is probably the big missing part. I'd say strategy is relatively easy compared to the hard yards of transformation and implementation that to do the things we know we already need. Perhaps my last comment is those big breakthroughs, the statins, the developments in surgery, the policy change that we know saves millions of lives, takes time. Yeah. So whilst we're investing in our health systems infrastructure, we must keep the foot on the gas for research. We know long term that's what drives the biggest progress and improvement, and we're, as a BHF, absolutely committed to doing that.
Definitely great, but not forgetting the implementation piece once the research has started. Yeah, it's interesting you say that because we're doing some research now about sort of the connection between innovation and health system performance. And I've really found that those things can be relatively disconnected when you look at it at the national level. But that's because implementation and the quality of that implementation and access is sort of the mediating factor for all types of innovation. So really interesting. Thank you. Terje, hello.
Hello.
Thank you for joining us. So I'd like to come to you and pick up on something Christina mentioned about data, because you've talked about how sort of the importance of data, digital health literacy, and citizens' trust. So how can governments and health providers strike the right balance between using data more effectively while also ensuring privacy, security, and public confidence, especially when we think about sort of people moving across borders in Europe?
Mm-hmm. Yeah, indeed. That actually reminds me the Nordic Business Forum, where I picked up 2 points. But first of all, it reminds me actually the Winnie the Pooh, who said that tomorrow never comes. Every day I wake up and it's again today. And in this Nordic Business Forum, there was said by one of the speakers that if we keep up cleaning the shit of yesterday, we will never be able to invest in tomorrow. And I think that is our problem in healthcare as well, that we have this legacy that we have to deal with and we have to live with. And it's not only that we have paper copies of the health records, it's also because we have a lot of procedures in place that are not evidence-based and are there because always has been done so. Some have been dropped, thanks God, some have been dropped. But still there are non-evidence-based things that we do just because of the habit. And innovation, I don't say that it's all about the digital, it's all about the data. I think it is also about the procedures. Somebody in the previous panels also said that it's a lot about the way we do things. Even appointment hours in the outpatient clinic are quite standard, but we could be flexible in it, and it's already an innovation. So maybe in this workload sharing, they're looking for the competencies instead of professional curricula, but the competencies that are needed for delivering what the patients need would be quite an innovative approach. But coming back to the data, another quote from that forum was that in order to connect the dots, you first have to collect the dots. And I think we are not there. We are not there. Somehow I have got an impression that when we talk about the health data, then everybody gets excited to collect more data. But we don't even use the data that we have in a good way. Then they say, yeah, but that's a question of the quality of data. It's not necessarily the quality of data. It's the question of interoperability that we are missing. And I very much hope that the EHDS will address these missing points and will allow us to collect the data. But there is a lot of implementing acts that is going to be implemented. So if I'm thinking about the Cross-Border Healthcare Directive of 2011 and how many e-prescriptions we can exchange now, 14 years later, across the borders. Yeah, we are still cleaning the shit of yesterday.
Great. Thank you for your reflections on that. And I think that that's really important. And I think your point about interoperability gets back to this theme of implementation and that sort of being incredibly important.
Well, if I may add,
yes,
I am coming from the hospital.
Yeah.
The hospital where the majority of these health data, majority of the health data is generated outside the hospital. But a lot of data about a patient, I would even say that it's not so big, but it's deep. We have a lot of information about a patient. Even within the hospitals in Europe, this data is not available for each and every step where patients going. We are lucky. In Estonia, we have the nationwide health information system where you have all information about the patient who has visited whatever healthcare institution. It goes all into the same database. But we are 1.3 million only. For the considering the fact that we are moving more and more towards the personalized medicine, and it means that more and more diseases become rare, then this cross-border cooperation is essential.
Yeah, that makes a lot of sense.
Yeah.
The landscape.
It's a good investment, actually, to put in money into this.
Okay, noted. Thank you. I'm going to come to the audience for questions shortly, so start thinking about your questions for the panel. But before that, I want to tackle a core issue that we've heard about already in the day so far, but would really like to kind of dig into it. And that is this sort of trade-off between long-term and short-term gain. So when we think about health budgets and political cycles, is it really about sort of making the case for these long-term gains, or are there mechanisms that help sort of bolster short-term wins and lock in investment in prevention and innovation, even when political priorities are changing? And that's for the full panel.
So I can start. Probably an example it could answer to your question. I'm from Italy. In Italy, during this year, we increase our budget maybe 5 or 6 billion euros per year. And I think really that we need to understand how is the increasing for each year, but it's not enough today. And I give you another example. In my experience, I was counselor for health in a big region of Mediterranean, Sicily. I come from Sicily. And I was counselor for health for 5 years, a long time. During that year, we have the pandemic crisis. When I start my mandate, the Sicilian budget for health was 7 billion euros per year. Now, the budget for health is maybe 10 or 11 billion euros per year. But if I have to be clear, I don't see a lot of difference for patients and for citizens between an increase of budget of 20%. So it's important for me to understand how we spend money, which is the quality of spending, and what we want to do to make our system safe.
Interesting.
And may I just say, so in regards to kind of this trade-off, I mean, there are long-term benefits, right? We've seen studies that show that this does happen on long term, but there are actually short-term wins too, right? When you invest in strong innovation, you will actually have, offset healthcare in other areas, like reduce hospitalization, reduce side effects, and so on. So there are benefits to be made in the short term, and there are benefits, as we said, in the economy. There are studies saying, you invest €1, you'll get more than double back, aside from the health benefit, just from improved productivity, improved employment, and so on. So I think the problem is not necessarily, I guess, the long versus short term. It's actually more the segmentation potentially of how budgets work. I saw your comment about where is prevention sitting, right? And who's accountable for it, So I think that's one really important thing. But I also think that with budgets, I think we need to set the scene, because everyone's saying budgets are increasing, but actually we should look at budgets as a proportion, right? Because everything increases in life. And the data mostly, on average, at least for Europe, shows a relatively stable trend for healthcare. There was a bit of an uptake, I guess, close to COVID, and which has come down a bit. So no huge increases proportionately, right? The percentage of GDP has remained relatively stable. For pharma spending, for example, that's been flat, slightly declining. It's actually the slowest growing area of health expenditure. So I think we need to sort of understand, what do we want to do? And as you said, you're seeing you're investing more, but you're seeing great benefits, right? But we also have much many more patients. We've got older patients which consume more resources. So we should be expecting to see this trend. I look at cancer, for example. Cancer, we're going to see a 77% rise in cancer cases by 2050, right? That's 35, I think, million patients roughly. So, but at the same time, if you look at cancer spending, it's relatively stable at 7%, right? So 7% spending when cancer actually has a very disproportionate burden on the health system in terms of death and disability. One could question, are we investing the right thing, or are we just shying away from investing where it's needed? But that's just a bit of my personal sort of maybe frustration here. But I do agree that I think it's not necessarily we're trading off long and short, and we shouldn't see it that way. It's probably the measurement and perhaps the way the system is fragmented, I would say, in terms of who owns the budget, who owns the benefit. If you're a country leader, you want to see your country having great outcomes, right? And if we look within the EU, you're seeing, for example, screening level. We were looking at colorectal cancer screening data with my colleagues the other day. So, it's probably more than 70% in Finland, and other countries have roughly 3%.
Yeah.
I mean, this is just within Europe, right? We shouldn't be seeing these stark differences. So, but who is accountable for that within the system? Who will be questioned? Why are these patients not being screened? Is it the person who owns the budget? Is it in the healthcare budget? Is it in the finance budget, though? Where does this sit? And you probably know it much better being on a national level and seeing that in practice. So just my two thoughts.
If I may say about the screening, we have the state organized 3 screening programs, but the participation level is nevertheless low. Even the non-insured people can go, if they are in this age group, they can freely go for the screening, and if that something is discovered, all the rest is also covered by the health insurance fund. But they don't participate in it. And I think that reminds me very much, as we are now in London, that reminds me very much what I heard from London colleagues years ago. It was about the colon cancer screening program in the UK, which asked people just to simply send a sample of stool by mail. Yeah, and it quite failed. There was not much participation in it. And that was a survey. Why people did not participate in it. And I would say that these replies, they very clearly indicate that we have to have the tailor-made messages for people, because most of the women, you can imagine, what was the reason why women didn't do it? Because they said that, how can I put something like this in the royal mailbox?
We've moved on a little bit in the countries.
But what was the reason for men? They didn't want to know the answer. I think that is the lack of health literacy here. They don't know that if they will discover the disease before they have a problem, the symptoms, then this can be cured. They can completely be healthy afterwards. They don't know it. They wait until it hurts. And then it may be too late. So I think that investment in health literacy in all aspects, if you quit smoking, your risks for certain diseases are lower next day.
Yeah.
Well, you can't quit every day so that it's a cumulative effect. But in principle, it is not always like a long distance achievement. It's the low hanging fruit. And even if it is a long distance achievement, then we shouldn't do it just because, we will not achieve anything in my political career. We started in Estonia the sexual reproductive health education for teenagers in 90s, middle of 90s. And that was an option. We didn't have much money. And it was the question, which age group to invest? And we invested into teenagers. Also, the majority of the unwanted pregnancies were in the age group of 30 plus. But we invested into the teenagers. And we learned from the Dutch colleagues that with the sexual and reproductive health education, you actually lose a generation, because these teenagers that you train will train their children. It's a kind of attitude question and the responsibility. that comes within the family and that comes with children. But it didn't stop us. And I have to say that the situation now in this field of unwanted pregnancies has improved dramatically because of that investment that we did 30 years ago.
Interesting. Really interesting. Thanks for the example.
Amanda, can I chip in on this? So,
Yeah.
maybe with a slightly controversial statement for the Economist afternoon, which is completely agree with the points on fragmentation and also of having the courage to make choices. So I think there are lots of choices to make, both in the EU CV health plan, but also in our own UK domestic 10-year plan too. And that's hard because you've so many stakeholders in a complex ecosystem. I think the controversial point is, I don't think it's all about budget for sure. It's about making choices within that and being confident politically and transparent about where we see those being. I mean, we don't have a choice but to invest in health and invest in prevention. In the UK alone right now, this year, CBD is estimated to cost us, cardiovascular disease, £30 billion, so huge economic toll as well as the devastation on heart health. So we don't have a choice, but I think to the point on transformation earlier and just sheer innovation, AI stethoscopes that can detect heart disease in 15 seconds, personalised medicine, the ability for all of us to have more ownership and access to our personal health data, I think are things that are transforming us faster than we can understand the impact of. So again, without coming back to a plan every time, it's, I think, really important for us to have clear plans for health so that whatever sector you're in or whatever role that we play in delivering of that to ultimately help people have better and longer lives, that we understand how to kind of track in behind it. So I think my controversial point is, I think it's about courageous choices and often politically courageous choices rather than necessarily budget all the time.
Sure. I think that's totally fair, and not just about courageous choices, but just courageous action to begin with, Great. Well, I have many more questions for you all, but I do want to give the audience a chance to jump in. Please feel free to raise your hand if you have a question. Yes.
Hi, thank you very much. Just a question based on sort of comments from I'm sorry, I don't remember names, on the left-hand side of the stage, around not using the data that we already have, and then how that links to sort of shiny new toys, to use it in a slightly disparaging way. I'm a clinician. I don't have time in my clinic, let's say, to do my job properly as it currently stands, to go deep enough and thorough enough to how I want to utilize all the evidence I've already got, whether that's patient specific or wider case, time to do my CBD. If you were to then, increase, for example, like, I don't know, your smartwatch data that comes to me, or being given something else, it's a lot of noise. And I wonder what your thoughts on whether that distracts from the actual case at hand, and whether some of this stuff, to go to this point about misgeneration, we just have to accept it is for how it is now and work towards building something new and better and more streamlined going forward, and how that looks.
But that is very true. If I tell my friends, doctors, about that, there is a wonderful new app that your patients could use, then they say, they don't tell me about that word. Because no more screens to open, no more databases to go. So that is what the idea of it is. It is 20th century that you go through all different books and data. Now we should be able that machines will do us for the search of information. At least in our health information system in Estonia, we have organized it in a way that the most important data about the patient comes on your first screen. All that has happened recently and that is important, or that is important from the medical history of a patient. Because nobody wants to go through different kind of pages, log in, log out, then you have forgotten the password. It will take hours, 20 minutes, which is usually appointment time. You can't do this. That's absolutely normal. And that's what I say, that we don't even know what to do with the existing ones. I mean, we create another database. But that's not 21st century. Let's think about this tomorrow's conference about what AI can do. Yeah. No more apps in that sense, that on your screen. No.
All right. A message to the innovators out there. No more apps. Any other questions? Yes, this side of the room.
Hiya. Thanks. Yeah, really interesting discussion. I'm Thomas Meek. I'm with a publication called APM. And we've heard a lot about the importance of investing in innovation. And a few speakers have touched on sort of the wider geopolitical environment. And that includes real pressure from the US for Europe and the rest of the world to increase prices and increase spending on drugs. And we've already seen a few examples of companies increasing prices. So I guess how does that fit into this discussion? And are we moving in the direction of some innovative medicines just being unaffordable for Europe as well? Is that where we're going?
I guess it's...
If I may
yes, right.
say, it's not only the US, we also get the pressure from the East neighbor to invest into military things. So, yeah, the money is still the same amount, you know.
I see, but
That's a big question.
no, please.
I mean, I guess this is probably a statement right now. All that's coming out of the US, I guess it's a very fluid situation, right? And we don't know. We've got the geopolitical pressures. We've got the US, what we're seeing, but it's still something, I guess, that remains to play out. That we see what the impact will be across Europe. But I think Europe, there's currently clear pricing models where they're regulated by the governments through negotiations, through HTA assessments, and so on. So that's the current framework, I would say, right now in Europe. But I don't think I'm right now in a place to speak about how it's all gonna land in the end with all this situation going on with the US administration, I guess.
I think that it's the same. I think that we have now to understand how is the relationship between Europe and US. As you know, we have a tax problems, and now probably we will have a tax problem on biomedical products. So I think that we have to understand very well, because sometimes they change their opinion, but probably we have to do more as Europe. Now, for me, it's not important how is the real relationship between Europe and US, but we have to understand how Europe can be better.
I agree with that. And I think it's fair to say, and it was raised before, I think we really need to reinforce the competitiveness of Europe. It's come out in the European plans. It came out in the Draghi report that we are faring behind, right? And your fellow Italian. But we need to, I guess, up our game, as one would say. And I think we are seeing movements in the budget sense. But we need to be stronger, I think, in terms of our competitiveness. And that will make us less volatile to these situations, I think.
Great.
I look at the watch there.
Yes.
Time is ticking. I would very much like to say two things.
Please go ahead.
Very brief.
Go for it.
One is
floor is
that
yours.
we have to invest into patients or citizens because they are unused resource. There is no more people to work in the workforce. Patients are there. They are ready actually to contribute. And second thing is that we should look for unusual partners, like the investment in health. The primary prevention to be healthy. These kind of investment can come from sports facilities, from food industry, from the partners that we usually don't have around the table. But if we would cooperate in this, then I think it would be they can do a good investment into this field.
Yeah, I couldn't agree more. And you anticipated my wrap-up question perfectly. So we'll have to be brief, but for the other panelists, if you had the opportunity to set one big priority for health investment that you feel like would make an impact on outcomes in the next decade, what would it be? Sure.
I'm going to start just by saying I think we need to invest way more heavily in prevention.
Yeah.
We know what to do. It's more about the implementation of how to get it done. For our biggest burdens, I think we understand quite robustly what the actions require. But yeah, I'd say invest in prevention, and we'll regret not doing it if we don't now.
Certainly. Yeah.
Yes, the most important investment is on prevention. Maybe an example is clear. We invest in European state member on prevention, the 10%, from the 10% to the 20% of state budget is too less. for the future.
Great.
I mean, I think I totally echo this prevention point. And if you look at the data around the missed opportunities, the avoidable deaths, the toll is huge, and the economic burden as well. So fully echo that we do need to do more in prevention, but equally, I think, as I mentioned before, the whole pathway, making sure we've got, better diagnostic techniques, innovation in treatments and cures coming forward. I think, of course, the whole pathway, I can't neglect that, but prevention, huge role to play, agree.
Great. Thank you so much. Please give a round of applause to our panel.
Thank you.
Thank you.